this particular strain and this outbreak, so this is a mutated fast-spreading strain that has come out of the DRC, the Democratic Republic of Congo in Central Africa. Africa is the only continent in the world that Mpox is endemic. And the last time we had a global health emergency around Mpox, that was in 2022, and it was actually declared not over, but the alert level, which is the highest alert level that the WHO can call, that was ended in 2023, so about a year ago. And that was a different strain, which was a less deadly strain. So this strain is more closely related to the endemic strain found in parts of Africa. It's spreading from the central parts of Africa east at this stage. We've seen it in countries as far east as Kenya. I would like to say that the global risk is low, but the WHO Director General did say yesterday at their press briefing, where they announced this fake or this global health emergency, that it is very worrying that it's spreading fast, that we've already seen it spreading east. And as we saw with other pandemics like COVID, only really need a few people to be jumping onto an airplane, and these things can spread quite quickly.
What actions are being taken to contain this?
It's an incredibly tricky area to work in. The DRC's a big country, and it is it includes areas that are highly forested, and surveillance is not where either the WHO or the Africa CDC would like it to be. And maybe most importantly at this particular point, we still don't really have vaccines on the ground. So back in 2022 and 23, with that global outbreak of Mpox, there were countries, predominantly in the West, who stockpiled the vaccine. And we would like to see, I guess, those vaccines really reaching the ground. The Vaccine Alliance, Gavi, has said that they have vaccines ready to deliver, but they've got to get orders effectively from the governments. One of the problems is that the vaccine is quite expensive. Africa CDC Director General has pegged it at about $100 a dose. And these countries that we're speaking about are certainly less affluent than a lot of the countries that were ordering vaccines back in 22 and 23. So there's going to be some delicate price negotiations in the coming days and weeks, I'd imagine. The agencies like the WHO and Africa CDC are certainly working very hard to coordinate this and to get vaccines on the ground.
All right, Janice.
Vaccines aren't the only measure. There are other measures like antivirals, etc. So there are other things that can be done and are being done to try and contain.